So thank you to everyone who is in attendance this evening or this afternoon, depending on where you are. We appreciate it. I'm Dr. Leah Jeanette. I'm so glad you could join us for our webinar to learn a little bit more about our Masters of Arts in Bioethics and Medical Humanities and our program outcomes. It's a wonderful program, and I'm so delighted to talk to you more about it and to be able to just share about where our alums have gone on to do wonderful things after their time in our program. So I'm going to go ahead and get us started. All right. So just as an agenda, we're going to cover a little bit about Case Western Reserve University, the School of Medicine, where we're located within the university itself. We'll talk a little bit about the program overview, just to kind of have a reference point, and then talk about some of the program outcomes, opportunities within the program, and how that can lead into these outcomes. Quickly review application process and deadlines, talk about student assistantships and financial aid, and then leave time for Q&A at the end. Speaking of Q&A, so if you have questions as we go along, feel free to enter them into the Q&A chat. There should be a feature here in Zoom that you can access. Please feel free to enter your questions as we go along. Happy to kind of keep an eye on it. And if I can answer it as we go, great. If not, I'll save it to the end and answer them then. All right, so this is me. As I said before, I'm Dr. Leah Jeanette. I'm the Assistant Director of Education and a Senior Research Associate here in the Department of Bioethics. I'm also a clinical ethicist at University Hospitals Cleveland Medical Center. The other kind of important thing to note is I'm also an alum of the master's program. So I am class of 2009. So it's been a couple of years since I've graduated. After the program, I went on and got my PhD in healthcare ethics and was delighted to be able to rejoin the department about 6.5 years ago and have enjoyed my time here. Part of my areas of interest include clinical ethics, adolescent health, and I really enjoy interfacing with our students, whether it's prospective students, current students, our alums. It's a wonderful department and a great program to work in, and I just thoroughly enjoy students. So a little bit about kind of where our program and our department are. We have, of course, Case Western Reserve University is in Cleveland, Ohio. Our department is within the School of Medicine. So the School of Medicine itself is ranked #1 in Ohio by US News and World Report, and we're 24 in the US for our School of Medicine. We're ranked very highly in terms of our medical education for research, but our department itself is really uniquely positioned because not only are we in the School of Medicine, we have a lot of collaboration and a lot of relationships across the university. So partners within the School of Law, within the Mandel School for Social Science and Applied Social Work. We have partners really across the entire university, but also in the community as well, which is a wonderful feature of our department. So with our hospital systems here in Cleveland, which we'll talk about in a little bit, we have great partnerships there as well, and community engagement. So it positions us in a really unique place within the university and the greater community, which I thoroughly enjoy, and I think it enhances our program significantly. So, one of the questions that kind of comes up as we kind of dive into this world of bioethics and medical humanities is, why study it? Why does it matter? Why is this important? And I think the kind of place to start is to consider the idea that healthcare and the industry of healthcare really impacts all of us, whether it's as a consumer, whether it's a loved one is seeking healthcare, or whether it's a profession. And so it impacts us in a myriad of ways, and how we interact with it, how we interface with it, how we respond to it can be a myriad of different things. And I think that has a lot of impact. Additionally, constant advancements in science and technology leads to significantly important questions. And a lot of these have ethical, not only implications, but have ethical concerns. And bioethicists and medical humanists, health humanists are in a really great position to be able to contribute to these conversations. So questions like, should we intervene in a situation? What kinds of values should inform policy and practice? Or even a question of, can we, and frankly, should we ensure justice and respect for persons and research and clinical practice? These are big questions to answer, and they're not easy to address, but these questions and many more questions that you can imagine are just one of the reasons why studying bioethics and medical humanities can be very fulfilling and very significant to any person's career path. And so the reason that it can assist, it can help a student's career path is because the nature of bioethics and medical humanities in and of itself is interprofessional. It's multidisciplinary, both in its origin and in its current practice. People who are in these spaces come from such a diverse background, not just personally and identity-wise, but also in our educational experiences. So not everyone has the same career path, which I think is an amazing feature of bioethics and medical humanities, and lends itself for students to then go in a myriad of directions for their career path. Ultimately, we have students that come to us. Some of them have a very clear idea of where they want their career to go, while others are still trying to figure that out. And we design our program in a way that helps students and can empower students in both of those possibilities. So we see students that go on to clinical, such as physicians, nurses, physician assistants, or even legal professions, whether it's a lawyer or working in a health policy space. It's really kind of amazing to see the variety of things that can fall under clinical or legal professions. We see folks work in regulatory work, the research space. We have alums who go on to careers in arts and humanities. This area continues to grow every year, and I love to see where our students go on to. We have students who go on to bioethics. I'm one of them, where after this program, I pursued a full-time interest in bioethics, and many of us end up in academics, in higher education, or even as clinical ethicists within hospitals. And then, as you can see, lastly listed is discernment. We've created an opportunity within this program, which we'll talk about in just a moment, that students who are undecided have the opportunity for discernment within this program. We see a lot from our students where they may have an area that they're interested in. Perhaps they want to be in healthcare, or they want to be in research, or they want to be in a certain space within the humanities world, but they're not sure how to get there, or what more specifically within that space they want to occupy or they want to pursue. And so this program allows for discernment and guidance on how to pursue that opportunity, which I think is really unique for a program like ours. So how do we do that? Well, our program is designed, this past fall celebrated our 27th year. We've been doing this for a while now. And so we've gotten to a place where we continue to reflect on how we offer our program, what courses we offer, what our curriculum looks like. And that's really important to us it's important for us to continue to reevaluate and to consider what's working and what's not, and to course correct when necessary, but also to allow for student feedback. And so within that, for full-time students, 1 year or 2 semesters, or if a student's looking for a more non-traditional or part-time options, the curriculum is really a customizable feature, which I love about this program. So while it is 30 credit hours, we have certain courses that are the core courses, things like Foundations of Bioethics 1 and 2, our clinical ethics rotations, which I'll talk about in just a moment, our capstone paper that all the students write at the end of the program. We also allow for 13.5 credits and electives. And those electives can really be identified and chosen based on where the student is headed in their career path, or what they're trying to explore, or the direction that they're unsure of. One of the things I love with this elective opportunity is some students, I'll give you an example, are really clear that they want to go on to medical school, but they know in pursuing the option of medical school, they may never get to take a law class that focuses on health. And so through this program, they take a health law class because it's a fantastic opportunity for them through this program. And it's done still within that realm of bioethics and medical humanities. We also have short-term study abroad courses that students can take as part of those elective opportunities, which allow not only for an exploration within a specific bioethics and medical humanities topic, but it also allows for cross-culture comparison and traveling to a different location, which is a fantastic opportunity for students. Every student is assigned an academic advisor, and so you get customized, personalized advising based on what the goals are for you within this program and how can you achieve those. And we have dual degree options. So some students within Case Western Reserve University are pursuing these dual degree options. And so they've applied to other programs within the school or within the university, as well as our program. And the rule is you have to apply and be accepted to each program separately and independently. And then once you're accepted to both of those, you would be within that dual degree. If you have questions about the dual degree options, it's a great chance to talk one-on-one more specifically. So within the program, there's also what we have is curriculum customization, which is really focusing on concentrations. So we have a traditional program which allows students to really open up their elective opportunities, and really students can focus in kind of whatever direction they're choosing within the space of bioethics and medical humanities. The Medicine Society and Culture concentration really hones in on medical humanities, social medicine, arts and humanities space. And it's a fantastic way for students to do a deep dive into those areas and to consider the influences on health, wellness, well-being beyond biology. It's a fantastic concentration. About half of our students end up doing that concentration. And then the other concentration is our research ethics concentration. This concentration allows students to do a deep dive in the ethics of research and the ethics in research. It affords students a really unique feature, which is a research ethics practicum. And students are able to partner with a research team of some kind and work on a research ethics project together their second semester of the program in a really unique way. It's customized to that student's areas of interest as well. So again, just other examples of how the curriculum really can customize and set students up for that next step beyond the program, and ultimately leads to fantastic program outcomes for students. One of the pieces of feedback we hear most significantly from our students is positive feedback about our clinical ethics rotations. These are course within our program that students continue to tell us they are thoroughly enjoying. They see the significance and the opportunity that is afforded to them by partnering with our healthcare institutions. You can see here Cleveland Clinic, Metro Health, VA Medical Center, and university hospitals. Students ultimately, by the end of the program, rotate for 160 hours within 2 out of the 4 of these hospitals. They do that in a myriad of ways, whether it's rounds with different teams, whether it's ICU, general floors, interdisciplinary teams, or consult teams. They might attend committee meetings such as ethics committee, IRB, rehab, transplant committee meetings. It's fantastic opportunities. Or it could be going one-on-one with healthcare professionals, such as visiting patients, attending meetings with individuals such as physicians, nurses, chaplains, social workers. The list is really unique to each hospital system. The goal is that students are exposed to a public institution, which could be Metro or the VA, and then a private institution like Cleveland Clinic or UH. We make sure that students are assigned to hospitals that make sense for their areas of interest, are accessible to them, whether it's through vehicle or what have you, concerning their needs. But these are great ways for students to extract the ethics of what they're seeing at the bedside. It really is an opportunity for the application of what is being learned in the classroom. And again, we hear from students over and over how significant these opportunities are for them within the program. We also have research opportunities for students in a myriad of ways. So our faculty are very research active, not only at the local level, but nationally and internationally. We have faculty that have grants and projects that focus on all different kinds of areas, whether it's NIH or NSF funded grants or funded by a private foundation. It's amazing to see the creativity of our faculty and the opportunities that students are able to partner with them to join on these projects. In order to ensure that students are adequately prepared to join these projects, we have something called our research seminars. These are opportunities for students to learn either new or improve on research skills that they may already have. Being within the world of bioethics and medical humanities, there is unique things to learn about that research area. And depending on the home discipline of a student, they may or may not have qualitative research experience, whether that was familiar to them or not. There's always additional things to learn. And so it's a great way for students to get engaged. We have lots of different opportunities to learn from those who are doing research, such as research core forums, to hear about ongoing projects, hear about works that are currently in progress, learn how the progress and the process of doing research, what it looks like, attend grand rounds to hear what case review looks like or topic review looks like at institutions nearby. And as I mentioned before, joining in on these projects are a great way as well. So I kind of want to switch gears to talk more specifically, like what do these program outcomes look like for our students? And so I'm going to go through and kind of give some examples of where our students have gone on to. I know everyone's career path is different. And so, for every single student, it's always a unique situation. And I could give hundreds of examples. We have, in our 27 years, I think we're probably close to almost 1,000 alums at this point. I could give so many different examples of students. We've got students who have attended so many different law schools over the years. They work in a lot of different settings, whether it be for a hospital as a lawyer, or they could be working in a public sector or the public health space, thinking about health policy, or working at a law firm with patients. It's really, really incredible to see how students that are interested in the law use their bioethics and medical humanities degree in that pursuit. I recently heard from one of our alums that this program helped her in the application of getting into law school, because when they were looking at her application and resume, one of the things that stood out was this master's degree. And because of that, she was awarded a fellowship because she was focusing on health law, which I think was a fantastic opportunity for her. We have many students who are pursuing healthcare. I would say about half of our students would, raise their hand and say they're some combination of pre-med or pre-health. And I would say from there, the majority that do end up pursuing medical school get in. One of the things that you have to keep in mind is students may start at the program and say they're pre-med, pre-health, they want to go to med school, but maybe by the end of the program, they've changed directions. And so it's not that they didn't get into med school, it's that they literally have changed their career trajectory, or we've had students switch from pursuing a pre-med career to going to law school or a research career. And so it's not necessarily a bad thing. It's just they've changed directions. As you can see, we have a list of examples of places that students have gone on to for medical school, nursing school. Students have become PAs. We also have students who pursue degrees in social work and become clinical social workers or community social workers. It's fantastic to hear from our students. One of my favorite things to hear from our alums is when they're in medical school or they're in residency, and they talk to us about cases, they're actively having to work through, and they're able to use the skills they learned in our program because we've set them up for success in those opportunities. And we continue to hear that, once students get their foot in the door, whether it's for a medical school interview or some type of other clinical program interview or even residency interviews, there's a lot of questions that come with, wow, you pursued a master's in bioethics and medical humanities. Tell me about that. Or what would you do in this case scenario? It makes for a great conversation piece when they get to those opportunities. So it's really exciting to hear from our alum in that area. We have students who end up going on to different graduate type schools, whether it be masters or PhDs. These are just some of the areas that students pursue, whether it's bioethics itself, anthropology, psychology, healthcare ethics, their history, sociology. The list could be quite long. We have such a unique direction that students can take, and I love seeing that of how students incorporate bioethics and medical humanities into their career path. And I ended up being one of these students that after this program, I ended up going on and getting my PhD in bioethics because I enjoyed this program so much. And I was drawn to the clinical ethics world and decided that that was the direction that I really needed to go in for my career path. But again, it doesn't have to just be people going into academia. They could be going to work in all different kinds of public or private sectors, not-for-profits, and so on. We also have alums that pursue research careers, whether it's clinical research, grants, project managers, coordinators. We have folks that end up being IRB specialists or managers at hospitals or for higher education or for companies. And you can see that there's a variety of institutions that they go on to work for. Again, I love hearing from our alum when they're in these roles and they get to use the skills they've learned in pursuing these careers in research. For some students, it's temporary. For some, this is their career path. And I think that's an amazing opportunity that students get to consider after this program. And then lastly, I always think it's worth noting that we do have students that are what we would consider like non-traditional. So perhaps they already have some type of terminal degree and they're looking to expand their educational experience, or perhaps they're changing careers. And so they complete our program either part-time or sometimes full-time, depending on their unique situation. They could also be part of one of our dual degree programs. And they have a specific terminal degree that they're pursuing at the same time as our program. These alums are really unique in their circumstances, and I love getting to work with these students, hear how they came to decide to pursue bioethics and medical humanities, or change careers or add to their career, and how they're going to use it in the next step beyond the time in the program. These students are always really excited and passionate and really add so much to our program. And I just love having them as a part of our cohort every year. So those are just some examples of, program outcomes for our students. It's kind of amazing to see the variety of places. And I just want to reiterate that it goes back to this idea of the world of bioethics and medical humanities being so interdisciplinary, so interprofessional, and it allows for students to go on to a myriad of career paths, which is amazing to see. So if you're interested in applying for our program, it's a fairly straightforward application process. We ask for transcripts from all undergrad or grad programs that you previously have been a part of. Unofficial transcripts are fine for the review process. We ask for a personal essay. This essay, what we're looking for is how or what is your interest in bioethics and medical humanities, and how does it fit into your career path? And that could be, 1 to 2 pages. We're not looking for anything too long, but really to get kind of a snapshot of that answer. We ask for a CV or a resume, and then 2 letters of recommendation, one of which comes from some type of faculty or professor or instructor that you've previously had. Once we have that completed application package, it's reviewed by a member of our admissions committee, and then someone from our admissions committee will interview you as well. Every person who applies is guaranteed an interview, and we will conduct that. Usually once we have a completed application, it takes 2 to 3 weeks to review and to render a decision. So it's a fairly quick process because we do rolling admission every year. In terms of financial aid, this question comes up a lot. We do have opportunities called student assistantships. These are teaching, research, or administrative opportunities for students. It's usually anywhere from 5 to 10 hours per week. And in exchange, students receive a partial tuition waiver. These are highly competitive every year. We look at both need and merit for students that are applying for these. And if you want to learn more, please reach out. We're happy to talk more about the details of student assistantships. There's also our financial aid office here at Case Western Reserve. You're required to fill out FAFSA, and then there's the traditional financial aid options that you can work through with them. If you're looking for more detailed information about tuition, Grad Studies has all those numbers, and I believe they'll have the upcoming year's numbers out very soon. And then in terms of lastly, just to kind of highlight due dates. So we are now actively taking applications. Our next due date is for the integrated graduate studies students. That application is due March 1st. IGS students are current juniors at Case Western Reserve. And then while they are seniors, they are part of our master's program. For others who don't fit into that category, our next significant deadline is actually which is not listed here, is our priority 2 deadline is May 15th. What we're looking for by May 15th is if you submit your master's application by May 15th, you are then eligible to apply for the student assistantships, which is that application is due June 1st. So we're working through that right now. We've got time, obviously before the May 15th, but we would encourage you to get your application in sooner rather than later so that you have a decision rendered and you can kind of work through that. Ultimately, our final application deadline is August 1st. We have orientation the end of August, and the fall semester will start at the end of August as well. So at this time, if you have questions, feel free to submit to the chat. And if you don't have any questions here, or you want to ask a more specific question to your situation, you can always reach us at bioethics@case.edu. I'm happy to set up a one-on-one conversation to talk about your unique situation, to talk more about how this program can work within your career path ideas and pursuits, and to connect you to the right people within our department and within our program as well. So I'm looking to see if there's any questions. One common question that we get is, why pursue our institution? There's lots of master's programs out there, and this is not meant to be a slight on other programs, but I think one of the things that our program does well is the high caliber of courses that we offer, the variety that we offer. But because we've been doing this for 27 years now, we've done a great job in establishing our concentrations, in establishing our study abroad courses, and establishing our rotations. And so as we've added new features to the program, we've done them at a pace that makes sense and that does it well. And so we have a lot of opportunities for students in a myriad of ways. And I think that makes us really unique. 160 hours of clinical ethics rotations is very unusual for programs. We're very proud of that. And the entire area of Cleveland, Ohio, Northeast Ohio has a lot of going on in bioethics and medical humanities. It's a really unique city. It's Midwest. Cost of living is down in this area. which is nice. But there's a lot to do here as a city, as an institution, as a program. And so it affords students just fantastic opportunities. So I'm not seeing any questions come in, but as I said, if you have any questions, please feel free to reach out, bioethics@case.edu. Thank you so much for taking the time to join us today. I'm so delighted that you were able to learn more about our program and our program outcomes, and I hope you consider submitting an application for us. And I hope you have a good rest of your day. Thank you so much.